Welcome to my podcast. Today I'm going to talk about another subject which is complementary to the healthcare professional. So it's not medical doctor thing. So it's another thing which called non-medical prescription. I just knew about it recently when I was attending the GP for the injuries that I sustained from the e-bike who hit me in my back when I was walking in the pavement. So it's basically a job which been done by something called a social prescriber. So when we hear the term social prescriber, it means that it's a social thing. So it has nothing to do with medicine or medical entity per se, but it's about social. So as the name imply, it's just basically make it clear that it has to do with the social life of the person or of the patient. The other term can be used, it's called community referral, a navigator, community connector, or a social linker. So it's a non-medical prescription which help and support people well-being basically, and it has been created to tailor to each individual needs. So it's personalized, and it's patient-centered. Like when we say we need to treat the patient, we need to agree with the patient management plan, so it's patient-centered. The same applies in this situation. It's patient-centered as well, and take into consideration the social, economic status. So it's personal-centered. And it works for each individual differently because we are different and each person needs differ from others. So it's basically, it's the same idea. When you see the patient, you will tell them what's that you want to see happen, or what's the most important thing in your life that it's bothering you and you want to tackle, or we can see how we can move things forward. So it's inquiring and exploring each individual strength in order to work on that strength and encourage it and allow it to move forward in order to improve the situation as a holistic approach. So it's a practical, social, emotional needs all in one go. Also, you can encourage a volunteering role, which makes sense of life, sense of meaning, sense of belonging. So it's a wider determinant of life, and it's whenever you come across this, you will basically try to refer the patient and signpost them to the things that needs to be dealt with. Also, it will encompass under the same umbrella if the patient have housing issue, if they have employment issue, if they have financial issue, benefit issue. So it's basically like enabling the shift from a deficit-based model to encourage the unique strength of each ability model. And in that regard, you will, as I say, you will explore the situation accordingly for each patient, and you will work in it. So you will ask the patient, for instance, what makes you happy? What's that you would like to do? What's that you feel that you need to concentrate on? So it's basically like empowering each patient to find their own motive, encouragement, and basically to navigate through asking the right question. So like, as I say, what makes you happy? What makes you feel better? What cheer you up? It's just like, as I say, empowering the patient and allow them to have their own autonomy in order to shape their own well-being and improve situation for them, such a solution-focused role. So in that regard, it's a holistic approach. It's addressing each individual differently, needs, promote health and well-being, and reduce health inequality. So by that, you will approach them collectively, personalize their care according to the issue that they have. This will allow them to see the positive thing in their life and move things forward, and also increase their connectivity and decrease seclusion and isolation. And rather than focusing on the disease, just is focusing about the health. So it's basically about health orientation in order to improve and shift things from the disease itself in order to achieve a lifelong approach target. So it's like a resilience with social connectedness and physical resources. So in that regard, you will, of course, explore with the patient from that regard what they want to do, how they see things, how they can move it. And it's usually, as I say, one-to-one meeting, and it will have a plenty of time whereby you talk to the patient. And usually it lasts between 6 weeks to 18 months. And you need to follow it up in order to see if the patient, they have achieved their goals, and just to see how they are doing so far. And in that regard, as I say, improving capability of each patient to emphasize their strength rather than the weakness. So basically, when you have done all of that, you will seek the local community network, see if there is any charity place which do some certain activity, and refer the individual or the patient for that issue to improve their health, their well-being, to live independently, to address their issue and what's mattered to them the most. In that regard, this will improve their feeling of self-sense. It will improve their confidence. It will improve their positivity and the changes in their life. And this will open a lot of horizon for them, and will tackle those issues. So in that regard, it's, the social prescriber, it's part of the professional team, including pharmacist, physiotherapist, primary care staff, GPs, health professional, and the role, as I say, you need to just address the patient main issue in non-judgmental attitude, and just emphasize the emotional resilience and employ a very good listening skill with communication skills in order for the patient to be cooperative with you and move things forward. So just it's like an assessment for the patient needs, and this will help to, of course, decline or minimize the load on the GP and the workload in the hospitals. And this will just, it's another tackling way for patients who have a certain health issue. So it's like befriending, signposts for exercise classes, art group, gardening project, weight management, patient interested in any other activity, for instance, to stop the smoking or support group, all of that fall under this category. So in that regard, in certain situations, it can be self-referral as well. And just it's a long-term intensive support to be undertaken by the social prescriber directly. It has been certain stories whereby this had improved and helped some patient in their situation, in their life situation, and just let them move forward and find a meaning for their life, in a way how to tackle the issue that they face and the stressor that they have in their life. Also, it has been stated that this social prescriber had a benefit because it will reduce the pressure on certain statutory services like NSH, GB surgery, hospital setting, GPI appointment, medical prescription, A&E attendance, and the cost around all of that. So it's effective as cost implication, and give the professional to help the people with their problems more efficiently and effectively in a strategic way. There is a lot of, mandate about the NSH and the emphasis of social prescriber that you can have a quick look. Also, nice guideline and Locism Act, partnership, collaboration, all of that. They want to transform the NSH in a long-term sustainability and investing in the vital digital infrastructure to improve the delivery of the necessary healthcare services where the need is needed, in order to of course, improving training, and in order to increase retention of the staff works, and of course in a modernized way. So it's a very important aspect as a way to deal with the patient from a non-prescription, from the non-medical prescription way, signposting them, supporting them, encouraging them, monitoring them, put a plan, smart goals into place and work on it, improve expectation and outcome, and when there is a need for a referral or signposting, just use them effectively, and just try to find which channel you need to refer to rightly with the patient need, in order to improve the patient or the client journey to make those changes they wish to and progress in life by identifying those gaps and work in them. So that's in brief. I just wanted to tell you about social prescriber and their role in NSH, of course, and in client or patient, generally speaking, and how they can ease the pressure on the NSH and the GB surgery and make positive and improvement in their situation in order to improve the well-being and the health status. Thank you.